How do antibiotics work to cure a UTI infection? Imagine a tiny battle happening inside your body when you have a urinary tract infection. The main enemy is bacteria, most often Escherichia coli, which can invade the bladder and cause discomfort. Antibiotics are like specialized soldiers that help fight these bacteria. They work by targeting specific parts of the bacteria to stop their growth or kill them outright, giving your immune system a better chance to clear the infection. One way antibiotics do this is by stopping bacteria from building their protective walls. Many antibiotics, such as amoxicillin or certain cephalosporins, interfere with the bacteria's cell wall formation. Without a strong wall, bacteria become fragile and burst open, dying in the process. This is especially effective because human cells do not have cell walls, so these antibiotics selectively target bacteria. Other antibiotics work by attacking the bacteria's genetic material. For example, some newer drugs like gepotidacin inhibit enzymes called topoisomerases, which bacteria need to copy and repair their DNA. When these enzymes are blocked, bacteria cannot multiply or repair themselves, leading to their death. This prevents the infection from spreading further. Some antibiotics interfere with bacteria's ability to produce proteins. Bacteria need proteins to grow and function, and antibiotics like macrolides or tetracyclines bind to their ribosomes, the cell's protein factories. By stopping protein production, these drugs slow down bacterial growth and help the immune system eliminate the remaining bacteria. Other antibiotics, such as trimethoprim sulfamethoxazole, block bacterial metabolism. They inhibit folate synthesis, a vital process for making DNA and proteins. Without folate, bacteria cannot survive or reproduce effectively. There are also antibiotics like nitrofurantoin that slow bacterial growth rather than directly killing bacteria. This slowdown allows the immune system to catch up and clear the infection naturally. Choosing the right antibiotic depends on several factors. Doctors consider which bacteria are likely causing the infection, local resistance patterns, patient allergies, and whether the person is pregnant. Common first choices for and complicated UTIs include nitrofurantoin, fosfomycin, and trimethoprim sulfamethoxazole. Sometimes newer antibiotics with different mechanisms are used to combat resistance. Treatment usually lasts from a single dose to about a week or two, depending on the severity. Proper antibiotic use reduces the bacterial load, relieves symptoms, and prevents complications like kidney infections or ongoing bladder inflammation. For bladder health, treating UTIs promptly and correctly helps keep the bladder lining healthy and reduces the risk of long-term damage. It's very important to use antibiotics responsibly. Overuse or misuse can lead to bacteria becoming resistant, making future infections harder to treat. Always consult a healthcare professional for personalized advice. Antibiotics are a cornerstone of medical treatment for UTIs, backed by extensive research and guidelines. They help restore health by targeting the bacteria responsible, but they should always be used thoughtfully to preserve their effectiveness for the future.